or like they always say, if somebody leaves it, nobody's going to get it done. Imagine if it's your loved one whose life is hanging on somebody's action. Medication stock out in care homes and healthcare settings creates serious risk, especially for vulnerable patients, including children and teenagers who rely on constant and uh, who rely on constant medication and give it to them at the right time. So, what are the risks of missed medications? It causes financial risk for the care providers. Getting a medication on emergency is usually more expensive. They have to drive down to different pharmacies looking for that same medication. Oftentimes, they don't end up with the same brand or the same prescription. It's just an emergency, which may not or may fit the use for the person. Besides that, it can lead to reputational damage. If I run a healthcare setting and times without number, I've had to call 111 to report that my patients don't have a particular medication or what they need at a particular time. It's all in the record. The 111 has a duty of care. You have a duty of care as a provider also. And if that is found wanting, you're going to have to pay for it. It could be the secrecy coming in to get you to pay a fine. It could be the family members of, God forbid, a deceased because of medication error. They are going to make a litigation, and then the healthcare providers have to pay to compensate for their errors. Aside that, it will raise their insurance premiums. So reputation, I've talked about reputational damage and operational risk also. Healthcare providers are supposed to look after the people who they are looking after. Once there is an emergency for a missed medication, these people need to start working administrative tasks. They need to start running around, become drivers, and their sole aim of working or their sole aim of the job is to look after those people who are in the care setting. But because there's an emergency, the care is reduced. They now have to run around. The trauma on the healthcare providers is something that could last for a long time also. So that is why I created Truth Metra. I've worked in a setting, and every time, at least in a month, we always have medications that are stocked out. The solution the manager brought up was put it on Teams when it's about to finish. Put it on Teams. There's nobody responsible for it. There's nobody calling the pharmacy. And at the same time, even if there was somebody, if the person was not available, it means that the problem will still exist. So with Truth Medtrack, it tracks the stock based on the dosage and pack size. That is because different medications come in different sizes and different dosages for different patients. This solution, it tracks, it sends alerts before stocks run out. And because this is an ideation, what I have in mind is for this solution to scale to pharmacies and maybe integrate with the NHS platform. 4 minutes to go. So if you can show the demo, that would be lovely. At the moment, I've just had it on Excel sheets. So what is going to happen is you put in the last medication order, because obviously we are not starting something new. We put in the last medication order. We put in the number of medication or pills in the pack. We put in the dosage. How many times in a day does the resident or the patient use this medication? And automatically it gives a result of uh, the date the medication is going to finish, and it's going to also give the date of the date when you should order another one to avoid stock out. This also creates a trigger alert for yourself and for the pharmacy to say it is time for this medication to be ordered. Yeah, so that is how this works. It takes the calculation of the caregivers. They only have to put in the supply, the date, and it does the mathematics itself. So this vision is going to start with the local care homes in Portsmouth, and then we can scale throughout the UK and beyond. And at this time, I'm only looking for partners, investors who would share in the same vision as I am sharing. And the vision is to ensure that no patient goes without having their medication as at when due.
Thank you very much.
Thank you.
Thank you very much. So we're just gonna have three questions for you. And please kindly make it short and simple. I mean in your response.
Well done, Troy. That was a good pitch. First of all, yeah, the problem that you've got does seem like a very big problem. So what came to mind instantly for me was because it's such a big problem, there must be tools like this already existing. So I don't know if you've done any market research into existing tools that maybe the NHS or care homes use to manage stock already. And if you've done that market research, what would separate you from what's already out there in the market? That's my question.
Okay, thank you for your question. So there are tools already in the market, definitely, but I have not found a tool that puts the care home in mind. All the tools are usually for the big brands, and yeah, how do I put it? They are for the pharmacies. For the pharmacies. Oh, I can hear myself. So the tools in place at the moment are for the pharmacies, not for the care homes.
Next question, please.
That's my question.
Um, Thank you, Victoria. Mine is more like a feedback. So, I think the biggest challenge here will be trying to aggregate all the pharmacies together because most care homes use boots, birds, and the different kinds of pharmacies. So the challenge here now is trying to work with social workers, the key workers, and also with the NHS to try and get a unified system because the pharmacies work with the GPs which create the slips that people use to go and get the drugs, but they don't take in account the care homes. And also, various medication providers provide the dosing at different levels. For example, some packets could be 16, some packets could be 32. So you need to make sure that the pharmacy solves that problem in this your unification. Another thing again you need the family response because most care homes and the people, the residents there, they are being paid for by the government and also some of them out of pocket. So there needs to be like a consent for you to have this information with regarding those things. Thank you.
Thank you very much for the feedback.
So my question is from the business part, and yeah, I'm looking at how do you plan to scale this product, and at the same time, are you planning to respond?
So this solution, I think, is going to run on software as a solution. So it's going to be hosted on the cloud. So there's no physical, um, how will I put it, platform to do anything. It's so in my head, what I'm thinking, because it's an ideation, and I'm open to learning and getting your feedback also. So I think it's going to be on subscription basis, depending on the care home size and the number of residents in there, and it will come up as bespoke solution also.
Sorry. Okay. So let's say I am investing. I'm not going to mention a certain amount. How do I make profits? And what is the return on investment?
I can't give you that figure now, unfortunately.
That's the reason why I didn't give you a figure as well.
Unfortunately, but I think it's going to run on the number of subscriptions that we've got. That would determine the revenue and your return on investment. I think.
I mean, I get the fact that you're still at a very, very early stage in the aviation. But then, having worked in the care space yourself, you have early adopters in mind, and as you well, these things, maybe even asking as questions about, I mean, NGDs are different. So maybe even as expression that you already think of finding maybe where you are. Is this something that started or what's where are you at?
Okay, so I'm working with a charity organization, and we've got different bills, the whole of Hampshire. So we have pitched it to my manager, and we are only trying to. And if that goes well, fingers crossed. I've got well, I will get the go ahead to try to discuss the other settings and then people
Don't worry about it. Don't worry.
very much.
Just make sure
Thank you very much.
you switch.
Now, the questions we have for now. Thank you.
You switch it back.
Thank you. Please don't be hard about you. Please only comment on that.
Yeah, just around there.
Thank you, Olamide. You have 7 minutes. Just thank you. Success. So take it away.
Yeah. My name is Lamine.
Please hold on. Please confirm the presentation.
All right. So my name is Lamine. I'm a staff web developer. Staff web developer. Growing up, these days I had childhoods. Growing up, my parents have 30 of us, and so there was a day I just came back from school when I was told, oh, one of the dogs died. Why? You know, access to medical services early as possible. So that got me thinking. I think that actually created an impression in my mind, which I didn't really pay attention to. So coming over to the UK, getting years, my friends started something about getting appointments, even personally, they're not supposed to be it's also that got me thinking. So picking my research that we shown that there's at 2024 about 29 million population of the whole UK, and we have about 5,000 vets clinics, and it shows that 51 to 60% of adults own pets. So that's a huge gap. I even try like plotting the graph and Instagram and couldn't even find the skill to fit everything. And also taking Portsmouth as a case study. I mean, this into Portsmouth as a case study shows there are about 86,000 households, Portsmouth. Then using the 21 to 60%, that's like 40,000 households with pets, and there are about 20 vet clinics, like, which is outrageous. The gap there is really, really crazy. So getting services are now becomes really difficult. And checking online and seeing some people started complaining it takes about 5 weeks to get appointments, even to get registered in a vet, it takes like maybe 2 months to get it. And there's areas in the UK whereby they get those access easily, whereby some other areas to get appointments it's quite difficult. So and then the idea popped in my head, okay, why not try bring sellers to buyers? And going about that, I've seen that there are about like apps. They also telehealth has become a new thing whereby you go online, for example, Meta, and then vets gets to get consultations or get like addressing basic issues like big skin irritation and minor issues they can give prescription and just so thank you. So I got thinking like, okay, why not create an application that runs like Uber services? You get to work with vets and all. For example, in Portsmouth here, I said Portsmouth and outskirts is 20 vet clinics. And some might be busy at the particular time while some don't have like patient at the moment. Why not get a platform whereby you get all the vets and you get to show the availability like in real time and show if I have a slot available. Rather than some areas being crowded and some lacking. So the app runs like Uber, like I said, it shows if there's a slot available at the vet clinic, then close by. It works using the map whereby it shows within your radius, particular radius, you said the ones that are available at the moment. I think that solves your problem. You can easily chat with them or have a video call and say, okay, I'll be there in this minute and chat that. Then you can get there and your pets can get treated. And at the same time, you know about your activities as early as possible. And also along the line, like it has a segment whereby your pet's medical histories can be included. So any vet you're going to, you get to see the previous treatments, the medications, and you know how to address the issue at hand. And I also have the idea of incorporating a store with it, whereby you get to buy products. It shows on the average that a pet owner spends about 1,200 a month on their pets, the stores and everything. So you get a platform whereby you get to buy toys and other services within time, making it a single application for everything you need. And generating, I thought about that kind of generating come from this kind of app. It goes by percentage basis based on when the treatment happens. A certain percentage is taken from the payment being made to the vet. The end users, the pet owners, they don't get to split so between their treatment and the vets. Rather than them having their time slot being wasted if they don't have any treatment, they can get treatment like vets 2 weeks more. And at the same time, we get to make some certain percentage from treatment also. And thinking about data analysis that's become a big thing now. Everything drives on data. Based on the sales and the treatments, we get to work with companies. You take A/B testing and you know where your products are being needed. They get to push more production towards just areas and the and we also get to make some. No, you still have 2 minutes. Ignore that. 2 minutes. So, like companies they pay to have access to such information, right? So their production to be optimized and they get to make more. We also get to make money from selling, giving them access to such data. So and it's not really tricky. Like I said, I came from Nigeria. There's a big market. So the basic production in the UK alone is about 7 billion pounds for the of starting from Portsmouth and Hampshire, we get to work with vets, then gradually scale up GODP, Adventure Africa. Because I've only seen few products like that, and they don't do like real time vets movement. They really show vets near you and maybe give subscriptions, prescriptions, and chats, which this app also will incorporate all this. We'll be starting with a web application, then later move on to mobile. Thank you so much, Alamide. That was fantastic contribution. I can identify a very key problem for a to question is if there are say 20 vets to about 20,000 pet owners, shouldn't the primary solution be to have more vets? Because if your platform shows efficiency, what about when it's a search? Because 20,000 customers will report to much need to have simplistic events, right? Frequently. So what then happens? Because there's obviously not enough beds to go around for everyone. So while you're addressing or solving the problem, really, the fundamental problem is still present, meaning which is the fact that there's not enough beds to go around to all. Like I said, it just shows the radius that you set. It can be impossible to city center, for example. And if it shows the ones near you, you can increase your search area yourself. Look at Uber, for example, at times picks the drivers around you. If he doesn't get in, tells you 20 minutes more, increase the price. pretty range in area search. We start from Portsmouth, we expand and get placed in Southampton. So peradventure, the ones in the Portsmouth are occupied. You can check on the app, it provides others to around you. Or want to go as far as
Let's wrap it up because we would take 2 more questions.
Before you, because let me just read. So what your platform can solve is simple. So you will need to create a triaging system in your platform. This system now creates systems to three particular. There are let's call it like small trust hospital. You now have local clinics. So your platform connects clients to the local clinics. Then in cases they cannot handle into larger clinics. So you create a three-way model. So this way you're able to generate profit now because you created a system that is self-reliant, whereby the local pet owners and they not usually get a lot of customers, not getting more clients. Then current centers now, bigger hospitals without advocates like surgeries and for the bigger cases. And your system is a free replay. So do that access and scope and also as a unifier for the small to the big and thereabouts. And that way you're able to handle that effect of not effects, the actual agents. It's not it's
Much for that. So key questions.
You mentioned that also you're developing yourself. I want to dive down into the tech aspect of it. Also, which was what
Don't worry about it. Oh, yeah. Basically, I'm seeing on the front end side.
Hold on.
Okay.
okay, symbol which is say fantastic idea. I think the first thing we should actually get you need to do that your platform is just a platform right. Escalation can now be at the point of to try. Most of the time people trying to put it up, it's even out of concern. So once has functional experience can be worked,
Right.
which is the first thing. And then issues and so on like that. Then we progress. So it's just to answer that. That's it.
Okay. Okay. So basically, I'm still on the front end side. We had JavaScript and the basics, like you said, API, the payments. Scratch. I'm not reinventing the wheel. So I check online, look for the best of the options I have, then try it because there's definitely trial phase APIs that you can use. So I have to try it, then see the best that gives me wiring energy, if I so say.
So, are you open to potential?
Oh yeah, definitely.
Okay. I think I am interested in the program. Both my years,
Thank you.
so we work together.
Okay. Thank you very much. Thank you. Thank you. Thanks for having me.
Morning, everyone. Morning, everyone. My name is Shilize Manago. I am a full stack engineer and an AI developer. I know some of you here, some of you are already my friends. So, hello. Oh, okay, yeah. So I know some of you already. So you guys are my friends. So money colleagues and judges are my friends. So today I'm talking about an application of which is called Silent Heart. It's addressing the problem I've personally faced and I know some other people are also facing as well. We've already had a couple of solutions around, I mean, some people things online, solutions around global talents, but I'm taking a different approach to it. So hopefully, it's interesting you guys. Next slide, please. Thank you. So in my analysis and developments, this problem I've tried to put into three particular problems for the points. So the first one is typically the global talent guidance is scattered. So aside from the high cost of consultations and everything we face, it generally scattered because of consultation tips and tricks and advices from different people. Second point is it's extremely costly. Again, using our personal experience, having gone through this process of consulting experts and even some immigration lawyers. So I can definitely say for a fact that this is a very costly process. And again, the last thing is with the advent of AI, even though it can do a lot of things, but we are not just at a point where it's not has enough expertise to give us probable advice or roadmaps to tackle this problem. Next slide, please. So my solution is a three-pronged solution trying to address each of those pain points. So to introduce peer reviews, grounded data, and the like, again, different pathways for you to be able to utilize application and even make some headway and roadmaps. That's like this. Okay. So how it works, it's a 5-step process. So the first one is the application itself is mostly community geared, but there are some AI features which will also help you, again, progress faster and again mitigate that point of the costliness of it. So the process is very difficult to make it down into different steps. So start by drafting your personal statement, which is one of the features that I provide in the application. Oh, by the way, it's actually live online now. So you can go to Talent Hacks or your mobile phones, laptops, whatever it is, and utilize the application. So you start with the drafting of the personal statements, maybe gathering your documents. The next thing you do is obviously you have a review feature. So you can put all of the different and documents and ingest the system. Security wise, I try to put an extra layer of security on top because when I was obviously having the testing phase, some of the experts I introduced, there's also a question around security. How am I sure that my documents will be saved or stored and be viewed by someone else? So that security is there. Only use your scan your documents as at the point of upload. We do not store anything. The only thing that we store will be probably the personal statements that you generate on the platform so that you can use the data around. But aside from that, we don't store anything again. So it's very secure, security wise. And then lastly, showing of documentations. I'm trying to make this a grounded system. I don't want it to just be another AI system that is going to bring spit out generic stuff for you. So there's a level of grounded I'm introducing into the application. So you monitor two-step. So the first thing, like it says there, is I'm using the global talent guide. So it will break those guys into different chunks and ingest into the system. Once it's done, we then introduce the other part of which LLM scan and it's not a combined version of the both of them. So you have your grounded response on what global talent expect from you, not just another random AI response. And then the elements basically helps you to understand what you're saying or understand different points. And then lastly, the analysis. So when you're done everything, you see a breakdown, what you've done well of each and every document, the different guidelines, and the respective points at which it's pointing to. So it's not telling you, oh, you need to do this. It's telling you, you need to do this based on this specific criteria and the global talent visa guide. And you can definitely verify that from the global talent guide. So next slide, please. The innovation and necessity parts. These are the different ways I feel like the idea is still innovative, right? Obviously, lots of solutions around this particular problem.
from having forms to specifically allow you to to book conversation with specific experts to even just some direct tools, just giving you surface level feedback. But with this system, it's introducing trust by design. Again, like I said, it's a human in the loop system. So where you can obviously have expert sessions, and even when you scan your documentation, you can still book in an expert review system for 3 different experts. It's all in the process there. Sadly, I can't even do like because of time, but I wish you guys can just take a look at it. And the last is who's baked in. Like I said earlier on, it's a grounded AI in it. And the last thing, the process ID, IP. Rubrics collaboration, things you need to do, like a clear roadmap from where you are right now to how to get to success. There's a roadmap. So what do you have? How good are you? Or how good is it? And then what can you do to become better or become the best? Next slide, please. So who are we? Basically the product selection kits. There are two major product selection kits here, but it's the third one. So because definitely the applicant persona, which is what we have now. Basically seniors, experts, they're wanting to be able to get clear customized feedback on their different categories or different documents and what they can do better. But that persona, which partner with someone because of consultants, experts, they can, basically use it as a first level, as a first trigger. So even if they don't expert to know, okay, this is where you are, I want you next. And then lastly, be able to fine tune this whole responses into a much more actionable feedback. Next slide, please. And then the markets. And it has identified 4 market points. B2C, the first one, which we already have now, is user front end and dashboard completed by me. Same as the experts dashboard. The experts can book, sign up, and even link their Stripe payment accounts so they can receive payments or whenever they have their session or plus. So that's the B2C. Basically, well, basically customers already different applicants. The B2B, which is the comment play with like the consultants. It is not a developed yet, but still, is a future task to I'm doing. Last is the beachheads and then the different that we can go to. Business model with the big points. While with this, I try to ask myself, how would this at least generate some income? Okay, which is so I'll just summarize here. So pass like this. This is the last slide. Business model. No, business model. I think I'll stop there. Thank you. So here is divided into 2 main points. So basically the system, in order to be self-sufficient, we have a point-based system. So obviously, you can buy certain points to do certain AI features like AI and personal payment generator. So that's one way you can generate income for the platform to be self-sustaining. And then the second one is going to be expert services. So you become expert and then you pay for the expert sessions. And in order to also encourage people to come to the platform, there's a referral. Somebody they come, they book a session, you get 10 points to do something else on the platform. So that way, even if you don't want to pay for points or you don't want to be able to book a session, you can pay for the different business. But yeah. He's trying to answer yes, possible. Thank you very much. Yeah, thank you.
Thank you, Chief. My question is, you mentioned a tree system.
Yes.
I'm guessing it has a lot system. So what makes the AI responses, what makes it comfortable from the AI responses different from what you can get from regular level ChatGPT, clone person? These LLMs are also grounded in responsible communicating from professional platforms and professional websites. So what makes yours different? Why levels come to your platforms which is going to ChatGPT, plugging in the details and take it to your screenshots of that application?
So what the application, I was able to test, and I had a lot of questions about APIs. I tested a wide range of APIs, right? And I can tell you for a fact that every time you put your application in any of these systems, you do not get a standard response. So you put it down, it's telling you you're good enough to go. Second time, it's telling you, oh, you cannot go. that personally came as a follow to me because I don't want something that will keep giving you different responses every time. So which is where the RAG system comes in. So yes, even though ChatGPT and the popular LLMs still have some level of understanding, but they are not grounded, which is where my system comes in. So before we get, obviously, the procedure LLM, but before we get the response, it prioritizes whatever technician says. So it takes the documents, scans different links, and then grounds your response based on what the technician says. Like I said, whatever you get, your response will be telling you this is what you've done wrong, and don't take it from me. This is also on the technician's guide. Look at the paragraph there. I wish I could show you guys a screenshot of the response, but because of time, yeah. So that's how my system is awareness.
Great presentation. So I am aware that there are other applications that is marketing at the Zoom surveillance.
So yes, I am also aware of some competitions. One of them being Technomads and I think some other generic tools. So I divided them into two parts. So there are the tools that just basically just no human interaction with it. You just come, view your documentation, and you go your way. So the problem with those tools is they generally give you responses, but again, they're not grounded. So you wouldn't really know, okay, even though you're saying, I'm not doing this well, how do I know I'm not doing it well? What's the criteria on which you're telling me I'm not doing this well? But like I said, in my own system, I don't say take my word for it. My system tells you this is what you're not doing well, and look at what technician says you're not doing well. But for the other one, I don't want it to just be another AI tool. I want it to be community based, so which is why I'm introducing the expert system. So you can still have a grounded response from other different experts, technician alumni, or global talent recipients, or even professors or actual immigration lawyers. So it's a two-sided application. So you have the human part of it, and then again, obviously the machine AI part of it. But primarily, it's the human part of it I'm trying to push forward, not just another AI solution.
Okay, so my question is taking a look on this prospect.
The benefit of Portsmouth will be, obviously, without saying much, will be a hugely improved sense of community. Obviously, you have experts that know this thing, and other human experts that know this thing, global recipients. So you can have a community of people helping themselves to obviously become the best in different technology spaces. And again, you can also get paid for it, which is where the whole business model comes in. So that way, even when other people you help receive the award or whatever it is, they have a reason to come back, right? So even though it's not just monetary, but at least you're part of the community, and again, you can earn something out of it, not primarily just money.
I'm going to be so I think the question first.
Yeah.
How do you manage expectations of those? Yeah, it's very essential. It is tied from by you. Like things to the stories. What's the and what the plan?
Okay, so to answer the question, initially when I did the first version of the response system, we used to have a score, but I tried to put away the score because it puts a certain level of fear in certain people because, like I said, at least small test group that tested it, and most of them opted to do the scores. So what you have now is just a statement: weak, strong, exceptional, that kind of thing. So in order for it to be grounded, the explainability comes in, which is why I use the LLMs, because LLMs are very good at explaining things in human terms. But I don't allow the LLMs decide or create the application. What the LLM essentially does is again, like I said, it's going to be the technician's guide. So it reads the technician's guide, knows what and what the technician requires, reads your documents, and then the LLM comes and then explains what and what you've done wrong by also quoting the different sections. So I have a picture of it on my laptop, but when you look at the response, it's pretty self-explanatory. So I'm not doing this well, or okay, I'm doing this well enough, but I can improve based on technician's guide. So like I said, the response is pretty good enough. And even the difference, each individual document you submit is scanned. So it tells you this document is good enough, but you can improve 1 to 3 points. So it's pretty clear enough, like I said.
And I think whilst you're talking, it just actually similar to what you have in financial space. It's kind of like, you know, there's a sort of regulation for financial participants.
Okay.
So it's always all gives it seems everybody understand.
Yeah.
Stay back in line to have it's very tell you how much it needs to be out how far it can go.
Yeah.
So you take a look at that, probably do also taking from claims from leadership where I mean the biggest income goes down
Yeah.
which is some kind of just exactly what brings
Okay.
take it
Thank you so much. Appreciate it.
Thank you very much.
Thank you, guys.
Thank you so much. Thank you very much. Thank you to our judges. Thank you to our senators for your all just right now. The judges are taking time to come together, discuss, and come to the conclusion. But while that's happening, one of our biggest sponsors, Barclays Eagle Lab, has a presentation today. And so that will be going on while the judges are discussing and speaking. So Barclays Eagle Lab presentation, that one. Are you ready? Okay. Just thank you for all the applause.
Right. Thank you very much, everyone. I don't work with Barclays, just for the record. Maybe one of these days, maybe a couple of years' time, I might be a consultant to Barclays. So, but we want to extend our gratitude and appreciation for Barclays giving us the opportunity to be part of, powering this idea. And as a result of that, we would be talking. I'll take you through some things about Barclays and what they offer in terms of services, because then these are very important for our participants, for the audience, for the attendees, and even for we, the panel of judges, and also for people that are in product, tech enthusiasts, entrepreneurs, tech entrepreneurs, and entrepreneurship in general, who are willing to go into to make their product tech driven. So, can you start from the beginning, please? Thank you. Okay, so Barclays Eagle Labs, they've been in existence since 2015, and the main goal is to help ambitious businesses to connect, innovate, and also to grow. Next slide, please. And then these are the list of communities and list of entrepreneurs, list of ideas they've been able to incubate. And I would say that this is the network of entrepreneurs, ideas, and corporates that they are working with over the years, and they are still working with them. So these, I would say that they have over 43 UK lab locations over the across the UK. I could remember vividly. I've always been living in Scotland, so I had the opportunity to know much about Barclays Eagle Labs back in Scotland, and I can say categorically that the tech ecosystem in the UK, which includes that of Scotland, cannot be cannot come into. We can't talk much about it without